I'm Dr. Phil Kieran.
And I'm Dr. Pixie McKenna. What can we do?
We'll be travelling around the country with our pop-up clinic and seeing patients with all sorts of health worries.
As far as
it goes.
Yeah.
Plus, we'll be bringing you advice on the latest medical developments,
Talk to me about bioidentical HRT.
so you know what you need to know to stay healthy.
This week, Pixie meets a patient who wants to see into the future.
What's it going to look like in 20 years' time?
Phil spots something that could be worrying,
You worried about it?
Well, it wasn't.
and Pixie discovers the dangers of ordering prescription drugs online.
We have included more tablets than you have ordered. It's so dangerous.
The pop-up clinic is in Drogheda for the Irish Maritime Festival. 68-year-old farmer Jim McCardle has come to see Phil about a burning issue and has brought his daughter Aileen along for company.
What can we help you with?
I had 2 sore-feet this last 4 years.
For 4 years?
Yes, constant. You think there was a bone and feeling in them at the moment, like 24/7.
And do you get good days and bad days, or is every day the same?
Every day is the same.
Same.
Every day is the same.
And if you're sitting down with the weight off your feet, just with them in shoes and socks, is that sore?
Nearly worse.
It's worse, is
Yeah,
it?
you get more relief moving around.
And 4 years you've been living with this. So
Yes.
what's been done for it?
Got MRIs done and
Okay. MRIs of the feet, or MRIs of the back, or MRIs of the legs?
back, feet,
Okay.
the whole,
Everything.
Everything. All blood tests done that could be done.
And they've all come back clear, have
All
they?
clear, all clear.
And have you seen anyone about the blood supply to the legs?
I have.
Done? Okay.
It's clear and got the nerves done.
You got the nerves tested as well?
Yeah.
Okay.
100%.
You're taking away all my easy answers for this.
Yes.
But I guess if it was an easy answer, it would have been solved by now, wouldn't it?
Yes.
And you're Jim's daughter, is that
I'm
right?
Jim's daughter,
And do you live
yeah.
nearby? Or
I
do
live
you
next door to Daddy, so...
Next door. So you see the
I
effect
see it on
this
a
has
daily
day
basis.
to day?
Yeah. Right. Huge impact. Come in on Sunday, Daddy was bed,
Okay.
because his feet were that bad.
Because they're that bad?
So I said, enough is enough. Something needs to be done.
Jim lives and farms in Termonfeckin, County Louth. He has struggled with his pain for the last 4 years. Jim has seen a range of medics who have asked all the right questions and tried a range of treatments, but his pain still persists.
I don't think people understand the pain. They think that more or less you're imagining it, but definitely not. But battering away at you all the time, trying to do a day's work like at the same time. Some days you might need to put your feet, if you're kind of walking on your heels, you just couldn't put the whole weight on your foot. You wouldn't be sleeping at night with it. It can get depressing because there's no let up at all in it. It just be hard with times. I'd do anything for an answer. That's just do anything for an answer.
And at this stage now, are you on any medication? You're on?
I'm on Lyrica
Lyrica
and Tramadol.
and Tramadol.
Yeah.
Do they make any difference to it?
No.
I'd like to take a look at the feet if that's all right, and we might bring you through to the back here and see what's going on. All right?
All right.
Just get you to come through this way with me. Now. Can you feel the buzzing there?
Yeah.
Close the eyes for me. Is it still buzzing?
No, stopped.
Oh, okay. Now, can you feel the buzzing there?
Yeah,
Close the eyes. Tell me when the buzzing stops.
stopped.
Right. The feet are completely normal to examine, right? The sensation is normal, the blood supply is normal, the movement is normal. They're lovely and warm, they're certainly not cold or anything like that. A lot of patients get very upset when the tests come back normal because it's almost like they feel, well, there is something there and you people don't believe me that there's something. But all the tests mean is that there's nothing structurally wrong with it, right?
Yes.
And this sounds very much like what we would call neuropathic pain, okay? So the nerves are generating the pain, okay?
Yeah.
But what's happening is the nerve that is meant to tell you when something is sore is sending off pain signals when it shouldn't.
Neuropathic pain is also known as nerve pain. This is where the nerve malfunctions and sends false pain messages to the brain. The type of pain might be burning, shooting, stabbing, or even electric shock sensations.
If you work in a job where there's a lot of vibration going through your feet, which if you're standing on a tractor or sitting on a tractor, it's all vibration through the feet, it can actually cause the nerves some damage as well, and that can cause problems. Clearly your feet aren't on fire, but that nerve is signalling to your brain, and your brain is feeling that sensation because it's being told to feel it. This is where medication comes into it. You may well need to be on some sort of medication to control this pain long term.
Phil will suggest antidepressants for Jim's neuropathic pain.
A lot of patients, particularly when we talk about using antidepressants to treat this, they go, oh, but I'm not depressed, I'm in pain. And that's exactly true, right?
Yeah.
But what we're trying to do is we're trying to use the nerve controlling features of an antidepressant drug to try and reduce the pain that's coming from this nerve.
Phil has recommended antidepressants as a way of managing Jim's neuropathic pain and has referred him back to his local GP for an appointment. At the Limerick Classic Car Show in Patrick's Well, the doctors are out and about looking to see how tuned in the car enthusiasts are when it comes to their health.
It feels very typically like what we would call a lipoma. So lipoma is just a fatty lump.
I just was walking past when you were down here and I noticed this little thing on the side of the face there. How long has that been there? Were you aware there was something there now?
Yeah, I'm aware there's two little brown kind of dots there.
Yeah.
Big freckles, if you want to call them that. But actually, it's funny you said that because my wife only commented a couple of days ago that she thought they got bigger.
She thinks they've gotten bigger. Okay.
In the last couple of months, but then just put it down to the sun, really.
To the sun. Can I take a look at the top of the head there and see? So there is actually quite a bit of sun damage up the top of the head there as well. Would you get sunburn from time to time? Or?
Oh yeah, very easy. And sometimes I find if I get sunburn, it kind of, sometimes I can get a kind of a rash out of it.
A rash down there.
Just on the arms there, like, you know.
Yeah, and the skin is very dry there. And there, you've got some sun today, haven't you?
Yeah, well, you would have. Yeah, it's very, very warm today.
And have you ever got this thing checked out? This one on the side of the face?
No, never got, no.
You worried about it?
Well, it wasn't.
You weren't? Sorry about that.
Yeah.
Now, this looks like a thing called a solar lentigo, or a lentigo anyway, which is a skin damage change related to excessive sun exposure. They do have the potential to change, right?
Okay.
And so I think it would be important to get it checked out.
Phil is concerned that father of four Gabriel Vaughan's skin spots are showing potential for cancer, and as a matter of urgency has referred him to a specialist for tests, which is clearly worrying for Gabriel and his wife Madeline.
We were just working away in the car and Dr. Phil just came over and said he noticed the thing on the side of the face and just asked me a few questions about it. You'd always get cut out in Ireland. Like, often I'd be outside only for a couple of hours and you wouldn't think it'd be that sunny, like.
Yeah.
And you come in and you'd have sunburn. My wife was saying the other day that she'd noticed it got bigger, like, you know.
I read somewhere that if it was big on the top of pencil and irregular, that's when you should, like, check it out.
It used to be that big. I think it's just maybe in the last couple of years it seemed to get bigger and change shape.
Yeah, but it's a bit worrying when they highlight it and say, you know, it might be something to worry about. Then you start worrying about it. Yeah.
You'll probably worry about it more than I would.
Phil will refer Gabriel to a dermatologist for further investigation.
While I'll never abandon the shopping centre or the high street, like most people, I also like to buy online. It can save time, money, and a whole lot of hassle. But increasingly, we're seeing a worrying trend towards people buying prescription medication online. And that's a shopping habit that could cost you dearly.
And it's definitely on the increase in Ireland. Reports confirm that everything from sedatives, painkillers, tanning injections, steroids, and erectile dysfunction pills are all illegitimately being ordered online.
So I'm going to see how easy it is to log on and get something that I'm not supposed to have. So I'm going to go for, not that I need them, some erectile dysfunction tablets. And let me see if I can get some tramadols. Some of them seem to be offering me a bargain. Some, based on my experience of the cost of medicines, are extortionately expensive. So let's see what arrives in the post.
When you order prescription drugs online, the Health Products Regulatory Authority may intervene. The HPRA protects and enhances public health by regulating medicines, medical devices, and other health products, including cosmetics. Over the past 2 years, the HPRA has seized nearly 700,000 units of counterfeit medicines.
Being at the cutting edge of it, what are people logging on for? What are they seeking out?
Sedatives in particular, products like zopiclone and diazepam. We're seeing anabolic steroids and erectile dysfunction products. We're also seeing tanning injections and slimming products. Many of these products will be, if they're prescribed by your doctor, likely for a short period, and it may be that the people are no longer able to source them or would not get the product if they actually went to their local GP. You have no guarantee as to the source. We would say don't take risks with your health. You have no idea what the quality of the product is that you're actually getting.
So I guess at best you could be getting something that's completely useless, and at worst you could be getting something that's potentially incredibly dangerous?
Potentially harmful, yes.
Dr. Pixie McKenna and Dr. Phil Kieran are travelling the country in their pop-up clinic, meeting people with all sorts of health worries. Over at the Blue Jean Country Queen Festival in Athboy, volunteer Sandra has popped in to see Pixie.
So, Sandra, nice to meet you.
And you, thank you.
What's bothering you?
I'm 49, nearly 50, and I think I'm going through the change.
Okay. Why do you think you're going through the change?
I haven't had my period for months. Then it came, and then it hasn't been for months. So.
Okay, so how long was that stop-start kind of thing going on for?
6 months.
Okay.
Then it came this time last year, and
Right.
then nothing
Haven't
since.
had anything for... Okay. What's been going on as a sort of sideshow to this?
Hot sweats, I'm grumpy, and sort of in the bedroom.
You sorry, what?
In the bedroom, there's none.
Okay. Broadly speaking, 80% of women will have some type of menopausal symptoms. And the symptoms that you're getting, the sweating, are the vasomotor symptoms. They're when your kind of temperature regulation just goes out of sync. You're sweating, you get the hot flushes, the flashes, the drenching bed. By definition, the menopause is the last period. You feel like you've lost your mojo in every aspect of your life. But I think that, you know, there are things that can be done. HRT isn't for everybody, but it's not off the table. But there are also a whole lot of other things that maybe you mightn't have thought about. Exercise, healthy diet, things like yoga, things like that relax you internally. To think of all of those, you know, there's more scope than just taking pills and medicines. You don't suffer in silence because you shouldn't have to.
Yeah.
It's 2017, there are things that can help.
Yeah.
Earlier, Jim McCardle came to the clinic with neuropathic pain in his feet. Phil asked Jim to see his local GP for a consultation and suggested a prescription of antidepressants as a form of pain management.
Philip gave me good hope. The way he was talking, and telling me what was out there for me, and that gives you positive outlook. I feel more lively or more energy, put it that way.
5 weeks on, Phil has come to visit Jim to see if there's been any improvement.
When I'm talking to people with chronic pain about this, I can often meet a bit of resistance because they think that I'm saying that it's depression that's causing their problems, and it's not. What we're looking to do is change the way the nerves signal. That's what antidepressant medication do. And if we can make the legs more comfortable or give you better quality of sleep and things like that, then that can often go a long way to making you feel better.
Yes.
Would you think that's how it's had that effect on you?
It has that effect, yeah. I can sleep at night.
Right, so the sleep has gotten better, has it?
Yeah.
And I have to ask you, Jim, how are the feet doing? Has the pain changed at all since I saw you last?
Not really, no.
Not really?
No.
Okay.
I've still 2 sore feet.
Right. With this type of medication, I wouldn't expect you to see almost any effect for 2 weeks, right? Not to get a reasonable effect for 4 weeks, and not to see the full benefits of it for 6 to 8 weeks. So I think we're at week 5 now. You're getting a lot of the benefit from it, but it could still improve, right?
Yeah.
The pain may stay feeling the same as it does, right? But if we can get you feeling less agitated because of the pain, if that restless feeling is gone from your legs, if you're sleeping better, these are all things that I would look at. Did you have any bad side effects from it?
No.
No?
No, none at all.
So if we turned around and said to maintain this benefit you'd need to stay on this medication long term, would that be a problem for you, do you think?
Oh no, you wouldn't know you were taking it, but it's doing something for me at the same time.
Certainly I would think that it's had a positive effect, and to stay on it would be the way to go.
Yeah.
A few weeks ago, Phil spotted Gabriel at the Limerick Classic Car Show and examined the solar lentigo on his face. As a matter of urgency, Phil referred Gabriel to dermatologist Dr. Patrick Ormond at the Hermitage Clinic for full examination.
The little lower one, I think, is probably just a sort of a sunspot. If you look at it like the back of your hands or on the top of your forehead, you have lots of sort of abnormal pigmentation, and that's from chronic sun exposure, just being out and about. And this one looks rather similar, except there's one small little area that sort of corresponds to that dark area, but there's a little change in the normal pattern of the pigment. Okay. So I think what I'm going to have to do is take a small biopsy of that area. And the thing that I want to make sure this isn't is a thing called a lentigo maligna. It can develop into a form of skin cancer called a malignant melanoma, which is the serious form of skin cancer.
Skin cancers are the most common type of cancers in Ireland. Early diagnosis of a suspicious skin lesion and skin biopsy can help identify cancers and lead to early treatment.
So this is exactly what we want people to do, is keep an eye on their moles and lumps and bumps, and then if they think things are changing, to get them checked, because once they're caught early, they're very simple to treat.
Dr. Ormond will take a biopsy of Gabriel's affected skin. This will be sent to be analysed for evidence of precancerous cells.
I'll give you a little numbing up injection. It feels a bit like a bee sting for about 10 seconds, all right? And then we're going to take a little bit of skin, just sort of the central piece of it, which is the darker piece, and then we'll put a few stitches in. So this is just literally, it's not the whole thing coming out, it's just a small little amount of it coming out. Well done. Gabriel 1, left temple.
With the biopsy complete, Gabriel will have to wait 4 weeks before he gets the results. Earlier, Pixie went online armed with a credit card and a postal address. She ordered prescription painkillers and erectile dysfunction tablets without a prescription. Today, she has post.
So 2 letters for me. This doesn't look like there's anything in it. Very official looking. Let's see. Okay, it's from the HPRA, the Health Products Regulatory Authority.
Pixie's order of erectile dysfunction pills have been seized because they were ordered without a prescription and were supplied illegally. In the past year, Gardaí and Customs have significantly stepped up and increased the seizure of illegal prescription drugs by over 200%.
So I haven't got what I ordered. I'm now on the watch list, clearly, of these guys, but also I've lost €50. This, on the other hand, looks like I might have got something. Right, 50 milligram capsules of tramadol.
Tramadol is a synthetic opioid like methadone. It's normally prescribed for moderate to severe pain. It can carry the risks of feeling sedated or confused and can be highly addictive.
To ensure our customers are completely satisfied, we have included more tablets than you have ordered. Can you imagine going to your GP and them giving you tablets which are very, very strong painkillers and then putting a note on the end of your prescription saying, hey Pixie, we thought we'd give you a few extra. I mean, it's so dangerous. In the wrong hands, I mean, these could cause absolutely awful medical problems, addiction, they could clash with a whole load of other drugs. But equally so, these mightn't even be the real deal at all. These could be totally fake.
Some of the drugs seized from online purchases were known to contain ingredients including rat poison, floor polish, paint thinner, and boric acid, a known insecticide. And along with seriously risking your health, if you're in possession of certain prescription drugs, you could end up with a criminal record.
I have a strip of tablets here, which are diazepam, 10 milligram. That is insane for someone to be able to source that online. Now, these were sourced several months ago, and interestingly, the legislation has changed since these medications were sourced.
Since May 2017, it's an offence to possess Z-class prescription drugs like diazepam without a prescription. The problem of unregulated medicines being sold online is global and also a concern to the pharmaceutical industry itself. Educating patients to avoid inherent dangers may be the only real solution.
On the one hand, we have our tramadol getting through the net. Then we have this, you've been a naughty girl, Pixie, ordering, trying to get some erectile dysfunction tablets. And then you have people who are probably still trying to source this type of medication, running the risk of a prosecution and a very serious addiction. you could really be paying a very high price, not just financially, but also with your health. It's definitely not advisable.
At the Limerick Classic Car Show, 52-year-old James has come to the clinic to ask Pixie about a past and future health concern.
Yeah, I'm just thinking about future-proofing. What's it going to look like in 20 years' time?
Walk me through what's happened here. What have you had done?
Road traffic accident, 1983. Broke both bones, but they're sorted. It's the vascular bypass element of it.
Okay. How long has it looked like this? How long has the skin looked like this?
Oh, donkey's years.
Yeah? Okay.
That's a skin graft as well.
I mean, it's very, 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 very dry.
See, I can't even feel your fingers there. Not in that space.
That's a problem. This is a vulnerable area that could, given the right environment, turn into something like an ulcer. And then you're in an entirely different space, yeah. The best thing to do for this is to really, really concentrate on improving the moisture of the skin. This isn't going to get better, this is going to get worse, so you really, really have to protect it. All right?
Okay.
So, moisturiser, probably a steroid on this, maybe needs a swab as well, but really, really protect it. And just think about your overall health.
I occasionally ring the doctor, just let him know I'm still alive.
Right.
And I'm still on the books, like, so.
You're still on the books. Well, maybe the odd checkup every so often wouldn't be a bad idea, no.
Okay.
4 weeks ago, Gabriel Vaughan had a biopsy taken of his worrying skin lesion. Today, he's back with Dr. Patrick Ormond to hear the results.
Do you remember I felt that it was more than likely this precancerous lesion called a lentigo maligna?
All right.
Okay, so it's good news and bad news. The bad news is it is a form of the precancerous skin cancer that I thought it might be. And the good news is exactly that, it's the precancerous form, okay? So this is something which could be years away to becoming a form of skin cancer called a lentigo maligna melanoma, okay?
Okay.
And that's the good news in the sense that when it's caught this early, it's entirely curable. This won't have spread anywhere. It's not going to, sort of cause problems from general health like a cancer would elsewhere. Okay. So this is caught nice and early, essentially. The next step of this is getting rid of those precancerous cells. Because this is precancerous, there are a couple of treatments. One is a topical cream called imiquimod, which is a form of cream which activates your immune cells within the area. The other option is radiation therapy to the area, just again, very superficial to just the top layer of the skin. I'm not too keen on that because you're quite young, and scars from radiation get worse over time rather than better over time. Okay. So then it's really down to the third option, which is surgery, which is where we excise this. So you're talking, somewhere about twice the size of my thumbnail removed, and then it takes about a year to a year and a half for the scar to settle down to what it's going to be, but you will always have a scar.
All right. Yeah, it was a lot to take in there, and obviously, when it was coming up, you just don't know what to expect. I wasn't expecting that answer, but as you said, it's good news and bad news, so the good news we've got it on time, and obviously it has to be removed.
Gabriel has chosen the surgery option, which will take place in the coming weeks. For Gabriel, the prognosis has been positive.